This video will cover the itinerary, the instructions, and the handouts for your mock OSCE station. In each of the online sessions, we'll be covering 2 example stations. Then you'll get a chance to cover at least 2 of the 8 mock OSCE stations. Each of the stations have been grouped into 4 categories of data interpretation, communication, history and symptoms, and clinical skills. We'll be talking through the practical elements, and then when you log into the online portal, you'll be able to see all the different videos on how to perform the practical elements. Each of the videos does have errors that you need to avoid and things that the assessor might look out for in the practicals. So if you haven't watched them yet, please do, and there will be more uploaded soon. The purpose of adding practical element to the online session is that you have a chance to think about your process in your head and cover all the steps, but you'll also be talking through the instructions that you might give to a patient. In each session, you'll get individual feedback based on your attempt of the station and feedback from myself as well as your peers, which will hopefully make your approach better long term. You'll get feedback emailed based on what we've covered and hints on areas that you might need to work on as an individual as well. We'll work through examples first, where I'll talk you through the station step by step, and then you'll get to attempt the stations yourself. You'll have 1 minute to read the instructions, then I'll call out the name of a student in a random order for you to attempt the station. If you're not attempting the station, listen, make notes, think about how you would do the station differently and what you liked about your colleague's attempt. You will need to print out this handout prior to your session. You'll see that this is the first slide on your handout. There are 2 examples that I'll work through with you, and as you're making your notes, these are the things I want you to consider. What do you need to do in your 1 minute? So what's your plan? And when you get inside the room, what are you going to do? What are the actions that you're going to take in that 5 minutes of the OSCE station? As you work through the station, try and use just the half of the sheet that's relevant for the time. Then you can train yourself to make the most of planning in that 1 minute before starting the session. So what I want you to do is, as we work through the examples, highlight the keywords from the instructions that you have while standing outside the door in your 1 minute planning. And if you're not performing, you need to note down how to approach the station, what signs to look out for in the record, and how you might explain a condition to a patient, for example. As we work through the rest of the session, you'll get a chance to at least 2 of the 8 stations. If you're not performing, you'll be critiquing the person who is attempting the station. This isn't to say that you don't point out the things that your peer has done well. Please write down and share positive comments, things that you like about your peer's attempts, so that you might include them in your own, as well as suggestions that you might have for them that might work better, so that both of you are learning from this experience. If you haven't had a chance to print this handout yet or don't have a printer, it's not an issue. It's really for your own benefit. So just write down the relevant points on a piece of paper. There will be a discussion after each session, so I want you to be able to give constructive feedback to each other. So please make the relevant notes and think about the things that you might want to hear about your performance. And the feedback that you give is going to be just as good as the feedback that you get then. Are you ready?